to the containment measures. Ensure you wash your hands with running water and soap, and ensure that you're wearing face masks at all times. Fellow Kenyans, today our coronavirus situation is as follows. In the last 24 hours, we have tested 668 samples. Today, we've been able to share with you a distribution as to the number of samples collected per county, and this will be availed to you. Nairobi still stands as the highest burden of disease county, and so far, we've run 478 samples in Nairobi County. From the samples collected today, we have 17 persons who have tested positive for coronavirus disease. This therefore brings the total of confirmed cases in the country to 320 cases. All the 7 are Kenyans, 12 from Mombasa, 5 from, all the 17 are Kenyans, 12 from Mombasa, 5 from Nairobi. 15 of these were picked by our surveillance teams, and it is important to emphasize the fact that they were picked by our surveillance teams means that these people were living within our communities. And fellow Kenyans, the evidence that is coming in from our testing shows us that indeed local transmission has been established, and therefore the measures that we keep on reiterating on need to be followed. 2 of these cases are from our mandatory quarantine centers. With regard to gender, 9 are males and 8 are females, and they are aged between 22 to 60 years of age. And on a positive note, we are glad to inform you that 6 patients have recovered and have been discharged, and therefore we now have 89 as the number of recoveries in the country. I thank you.
My name is Kenna Claus David. I just want to know from research consultants, the idea of quarantine, not only for the arrested, does it not spread a risk to the others? And also the element of cost, which
Thank you. Thank you all for your questions. Allow me to begin with the questions from K24 concerning the current containment measures and when we intend to either relax these measures or tighten these measures. So far, we do have a team that is reviewing the impact of the current measures that have been in place. We are looking at the impact of the current hand washing measures, looking at the impact of social distancing, looking at the impact of having 60% occupancy in our transport industry, looking at the impact of having takeaway services in our hotels. And therefore, we've come up with a matrix, and this matrix will be evaluated this Sunday during the NERC committee meeting, and therefore decisions will be made as to whether these containment measures need to be tightened or loosened, and therefore we'll be able to communicate with you at the end of this week. Concerning the issue of cost and bills that are emerging from the coronavirus response at hospital level, again, this is an issue that has come to light. We currently actually are having a database that is looking at the different billing data, both in public and private facilities. And when negotiations and engagements with the different players to be able to define a mechanism that would be adequate in ensuring that Kenyans who may not be able to meet these bills would have those taken care of. Again, this is communication that will be relayed through the NERC in the coming week, at the end of this week. I would like to invite the DG to come and touch on the issue of quarantine. However, it's important to note, fellow Kenyans, quarantine remains an approach and a measure that is being utilized the world over. And we have noted your concerns with regards to how the quarantine situation has evolved in the country. And indeed, we are working to ensure we improve and we actually meet the merits of having quarantine facilities that are able to meet our targets. That being said, we would like to remind you that some of our cases have been isolated at quarantine centers. Therefore, indeed, this measure has been impactful in protecting Kenyan lives. DG can come in and expound further on further quarantine measures. Kindly just...
Thank you. Thank you. I think Madam CAS has clearly articulated the issue of quarantine. It is our assumption that if we pick you as somebody who has broken the curfew, then you are treated as a person who could have come into contact with a potential COVID case. But what you have done is not to try and criminalize the quarantine process. One, we have tried to improve the conditions in the quarantine facilities, and now with the availability of the test kits, as soon as you arrive within the quarantine facility, is to fast-track the process of testing you. For those who test negative, of course, they are quickly released and are advised to continue self-quarantine at home. Those who test positive, of course, come into the isolation center for management. Thank you. Yes. Thank you. I've clearly stated in my earlier statement that we have tried to improve the quarantine facilities in terms of the hygiene measures that were taken into place. If there's a quarantine facility that does not have masks or hand sanitizers, it is probably just for a few hours, because we have masks and sanitizers in stock, and we'll ensure that we distribute them to all the quarantine sites. But regarding those who escape, the long arm of the law will always catch up with you. They managed to bypass these other restricted movement sites and went as far as Kericho. But again, the long arm of the law caught up with them. So even if you make an attempt to escape from the quarantine facility, remember, a big brother is watching and will soon catch up with you. Thank you.